Welcome to another lesson. We're going to be talking about diabetes mellitus this day, and we're going to, as much as possible, make diabetes mellitus lesson very simple for beginners so that it will be very easy for everyone to understand. So we begin with what diabetes mellitus is. And diabetes mellitus is a group of metabolic disorders that is characterized by high blood level of glucose that has been sustained over a period of time. So what that basically means is that you do a test for somebody, or you collect sample from an individual and measure or determine blood glucose concentration, and glucose is high. That's not enough to just declare that the person is diabetic. But when the test has been done, repeated, and certain precautions taken into consideration, and the test is done and it's still coming out high, then you could say, okay, this is a case of diabetes mellitus. Now, you can basically say that diabetes mellitus can be caused by either the inability of the pancreas to produce a hormone known as insulin, which is responsible for controlling blood glucose level in the blood circulation. So it's either the pancreas is unable to produce enough of insulin, or the pancreas may be functioning well, producing insulin, but the cells that are supposed to respond to insulin so that glucose can be driven across the cell membrane into the intracellular space where the glucose will be actually broken down. If that cell membrane is not responding to the action of insulin, then it can result in accumulation of glucose. But whichever way, it will eventually predispose or the individual, or eventually result in a condition known as diabetes mellitus. So let's look at, if we say, okay, let's classify causes of diabetes mellitus based on factors. We classify diabetes mellitus cause into either genetic factor or environmental factor. When you say genetic factor, that means it runs in the lineage, it runs in the gene. It is inherited. The person inherited it from a parent or both parents. It can be the direct parent, it can be inherited from the direct parent. It can also be inherited from maybe grandparents, great grandparents, foreparents. So it's possible that someone who is diabetic, someone comes and becomes diabetic, even though his mother, direct mother or father, were not diabetic or are not diabetic. It's possible that the father or the grandfather may not have manifested the diabetes, but the person may have inherited the gene that is now manifesting from the grandfather or great grandfather. It's also possible the person may not even be alive. So it's possible for one to inherit diabetes mellitus from a family lineage. It may not be direct parents, like I said earlier. It may be a foreparent, it may be grandparent. Then also another factor that can predispose an individual to coming down with diabetes is environmental factor. And this has to do with lifestyle and activity and diet. So an example is obesity. Now, obesity, somebody who is obese can is at risk of becoming diabetic. And so, obesity has to do with accumulation of weight, accumulation of fat as a result of maybe excessive eating or reduced physical activity. And so, these ones can cause an individual to become obese. And obese, once an individual is obese, the chances that the person could become diabetic if the obesity is not put under control is very high. So you can say that summarily, diabetes can be caused by genetic factor or environmental factor. Remember, we said earlier that diabetes could result either as inability of the pancreas to produce insulin, or the insulin is either is not producing insulin at all, or insulin production is not sufficient, or insulin is also produced but the body is not responding to insulin. So those are the um, causes that can cause diabetes mellitus. Now we want to look at type of diabetes mellitus before we now go further to talk about other information about diabetes mellitus. Diabetes mellitus has broadly been classified into three types. You have the type 1 diabetes mellitus, which used to be known as the juvenile onset diabetes mellitus, and then the type 2 diabetes mellitus, which used to be known as the adult onset diabetes mellitus, and then we have the gestational diabetes mellitus. So we are going to look at each of them briefly, one after the other. We'll look at each of them one after the other. Like I said, the type 1 diabetes mellitus used to be known as juvenile onset diabetes mellitus. So we have the type 2 diabetes mellitus, which used to be known as the adult onset diabetes mellitus, and then the gestational diabetes mellitus. So we'll begin with looking at the juvenile onset. The juvenile onset diabetes mellitus, which used to be known as the type 1 diabetes mellitus. Now, it's also known as the insulin dependent diabetes mellitus because basically the most common way of managing the type 1 diabetes mellitus is administration of insulin. Now, type 1 diabetes mellitus is a diabetes mellitus that occurs as a result of the failure of the pancreas to produce a hormone known as insulin. And so anything that affects the functioning of the pancreas, altering the ability of the pancreas to produce insulin, results in diabetes mellitus known as type 1 diabetes mellitus. And so because this diabetes requires insulin mainly for treatment, it is known as insulin dependent diabetes mellitus, even though in recent times it's no longer being addressed as insulin dependent diabetes mellitus. Is mainly addressed now as type 1 diabetes mellitus. Now, this inability of the pancreas to form or to produce insulin can be caused by maybe a loss of the beta cells. Now, the beta cells of the islet of Langerhans are responsible are primarily responsible for the synthesis and secretion of insulin. Anything that affects the beta cells, either maybe they are destroyed, maybe for any reason or for any purpose, and so because of that destruction or damage to them, they are not now able to produce insulin. That destruction or that inability results in type 1 diabetes mellitus. And so it can occur. Initially, it used to be thought that it happens or it occurs when in childhood. Yes, it's most commonly affected or caused or manifests rather in childhood, but cases have been reported where it happens in adulthood. So it's no longer juvenile onset diabetes mellitus. And so this type 1 diabetes mellitus makes up approximately the diabetes mellitus that affects about 10% of diabetic patients globally. And so it is mainly managed by insulin. The next one is the type 2 diabetes mellitus. Now, type 2 diabetes mellitus is mainly characterized by insulin resistance. And so it's either maybe the pancreas is not producing, maybe the pancreas may not be producing enough insulin. And so with time, the insulin resistance builds, or the pancreas is producing insulin, and then the insulin the pancreas is producing is not enough at all. Now, it is caused by maybe it can also eventually result from progressive insulin deficiency. Now, what do we mean by progressive insulin deficiency? Now, what this means is that insulin has been available, and then but after some time, because available insulin is not being used up, the production rate of insulin by the pancreas declines over time because of inability of the ones produced to be used off because of resistance. The cells are not responding to insulin. At the end of the day, that results in the ripple effect back down to the kidney, and so it will reduce the kidney's ability, back now to the pancreas, sorry, and it will result in the in a negative effect. The pancreas is not able to now produce more insulin. And so, but overall, insulin is available, but the cells of the body is not responding to insulin, and so there's accumulation of glucose. And this type of diabetes mellitus makes up about 90% of individuals who are diabetic. And then it is can be caused by lifestyle. It can be improved upon by lifestyle changes and also dietary changes. And then in some cases, in most cases too, medications can also be used to treat it. So that's the little information for type 1 and type 2 diabetes. We'll continue in the next class. Thank you.